from Louisiana's home team. This is Fox 8 Morning Edition at 6 a.m.
You know, with fall almost here, doctors want you to do a quick health check. Dr. Scott Simeon with People's Health and Cancer Physician Associates joining us this morning with some of the things you may want to double check with your doctor to stay safe this fall. Good morning. Thanks for joining us.
Good morning, Liz.
So what are some of the things, doing good, what are some of the things doctors check during a physical this time of year that you really want to stress?
Well, I mean, this time of year you want to look out for your vaccines. A lot of people are already starting to get their flu shots. But, you know, obviously at a physical, most physicians will check blood pressure, your weight. You know, these are just vital signs that you want to make sure that everything's under control. And, you know, I want to make a point that a lot of people come in specifically for sick visits. I have plenty of patients who come in, and the only reason they come in is I only ever see them for sick visits. But it's important to remember that to at least during a sick visit or maybe make a separate appointment for a preventative medicine type visit so that you can take care of all the screening tests that you need.
Right, because I mean, if you don't go for quite some time and all of a sudden something's detected, it may be too late to deal with it. If you let so much time pass, when was the last time you went to your doctor? Most people say, I really don't remember, you know? So what are some of the screenings that people should consider getting?
Well, of course, for women, your mammograms, you want to make sure that you continue to get those. Cholesterol check or lipid profile is what it's technically called at the lab. For men, prostate exams and a PSA. Colonoscopies, you want to check with your doctor and see the frequency depending on your family history, how frequently you need that, but typically it's every 10 years. An eye exam is always a good idea too. Sometimes people think, well, I see fine, but it's not just about your visual acuity, but it's also, you know, diseases of the eye. Getting a full eye exam, that's important too.
So, you know, and sometimes, you know, especially if you're trying to get your male loved one to a doctor, why is the prostate exam so important, and then also the colonoscopy?
Well, colonoscopy, of course, you know, all this is preventative medicine, and that's the thing, is that with preventative medicine, that's one of the main things, main types of medicine that I do. These are types of things we want to prevent disasters or prevent bad things from happening early. So, for example, a colonoscopy, if you have a small polyp, that can be removed quickly and rechecked in a few years, and that's something that can prevent colon cancer. I mean, that's what this basically is for. Same thing with prostate exam, PSA. These are things to screen you for prostate cancer because those, if they're caught early, they can be prevented from getting worse. Same thing with mammogram.
Okay, and you hit, you know, the breast cancer, diabetes, high blood pressure. These are all the things that, you know, you want to screen and check for if there are risk factors in your family, especially.
Right. Well, even if there's not risk factors, if you yourself have risk factors, whether you're overweight or some other issues that have come up, you want to get some routine blood tests, and the routine blood tests can maybe lead to more specific blood testing for diabetes, for other diseases, that type of thing. So, just, you know, I just want my patients and all people out there to think, no, don't just go into your doctor when you have a problem. You know, most insurance companies will pay for a full physical, in other words, no copay. They'll fully pay for a once-a-year annual wellness exam.
And before we go, vaccines. Some people may say, I'm not going anywhere, I'm not traveling overseas, what do I need it for?
Right. Well, you want to make sure your tetanus is up to date. The tetanus is done about every 10 years. Nowadays, they will throw in a pertussis part of the vaccine. That's something that we've seen patients need, is a pertussis. Obviously, flu shots every year. That's because the flu virus mutates every year, so you need a new vaccine every year. And then a pneumonia or a pneumococcal vaccine is something that you should get every 10 years if you have certain medical conditions, lung conditions, and sometimes it's just a once-only shot. Also, a shingles vaccine is something that's fairly new and most people are getting.
Right, okay. Some really good tips, and hopefully it will get some people to you or to their own doctor. Thank you so much for coming in. Have a great weekend.